Hello everyone. Today we are going to talk about anti-anginal agents. So, before understanding the concept of anti-anginal agents, we need to know what is angina. So, coming to the definition of angina pectoris, it is nothing but the pathological state of the cardiovascular system which is characterized by transient myocardial ischemia which may lead to imbalanced myocardial oxygen supply versus demand. So now what is this myocardial oxygen supply versus demand and how it is going to cause angina? So we can understand it by the following diagram. So if we can see it here, whenever there is increased oxygen demand and at the same time if there is decreased oxygen supply to the myocardial cells, this condition may lead to ischemia. And we know that what is ischemia? Ischemia is nothing but hypoperfusion of the tissue. In terms of angina, it is typically myocardial tissue. So this ischemia may lead to the various kinds of symptoms that like central chest pain may be there. The pain may migrate to the left arm, shoulder and jaws. Similarly, profuse sweating may be there. So many kinds of symptoms may be there which are associated with ischemia, and these types of symptoms are represented in a form that is known as angina. So this is the typical definition and concept regarding the angina pectoris. Now coming to the possible causes of the angina pectoris, we need to learn the possible causes of the angina pectoris, because as we will know about the causes of the angina pectoris, we can treat the condition with the drugs very easily. So there are two possible causes of the angina pectoris, that is number one is atherosclerotic cause and another one is non-atherosclerotic cause. Now what is atherosclerotic cause and what is non-atherosclerotic cause? So we all know that what is atherosclerotic plaque. Okay, it is nothing but the formation of plaque or formation of the solid particles in the arteries, that is especially the blood vessels. Usually the in case of angina, it occurs in coronary arteries. Okay, so if we assume this as a typical coronary artery, okay, typical coronary artery, here is the supply of the blood. This part shows the supply of the blood to the heart. So whenever there is flow of the blood to the heart through the coronary artery, if there is formation of the plaque like material or the plaque in the coronary artery, this is known as fixed plaque, which may lead to the obstruction in the flow of oxygen to the myocardial cells, and this may in turn lead to the ischemia, that is it may in turn lead to the ischemia, and which may in turn lead to the angina. So this is, so the angina caused by this fixed atherosclerotic plaque is called stable angina. Okay, now coming to the another one, that is whenever there is formation of plaque, sometimes due to the formation of the plaque and due to the inflammatory reactions, there may be formation of the thrombus, that is the blood clot around the plaque. So this is the plaque which is associated with the superimposed thrombus. So this may lead to the more severe type of angina pectoris, and this type of angina is usually known as unstable angina. Okay, this type of angina is known as unstable angina. Now coming to the non-atherosclerotic cause. Okay, so no, in non-atherosclerotic cause there may be either the formation of the embolus in the coronary artery, which may again obstruct the flow of the oxygen along with the blood to the heart, which may in turn lead to the angina. Another possible cause is that whenever there is vasospasm is nothing but the contraction of the blood vessels. So whenever there is contraction of the coronary artery due to various factors, this may again lead to the decreased supply of the oxygen along with the blood to the heart, and this condition may again lead to the angina. So these are the possible causes for angina. Apart from this, there also may be supply versus demand imbalance alone. So apart from the atherosclerotic cause and non-atherosclerotic cause, there may be one more cause for the angina, which may be supply versus demand imbalance alone, and this supply versus imbalance alone may be caused either due to myocardial infarction or due to myocardial hypertrophy. So these are the possible causes of the angina pectoris. Now moving on to the anti-anginal drugs. So what are the anti-anginal drugs? So these are nothing but the agent which relieves the symptoms of the angina or prevents angina in following ways. So there are mainly two ways by which it prevents the angina or relieves the symptoms of the angina. The first way is that by increasing the myocardial oxygen supply. As we all know that whenever there is myocardial oxygen demand is increased, if we can supply the oxygen amount of oxygen according to the demand or with respect to the demand, we can maintain the perfusion of the myocardial tissue, and hence the angina can be prevented or its symptoms can be reduced. And another possible way is that by decreasing the myocardial oxygen demand. Okay, so if we can reduce the workload of the heart, then obviously there will be decrease in the demand by the myocardial cells. So by decreasing the myocardial oxygen demand also, we can relieve the symptoms of the angina. However, these 2 points may be considered for the drugs. Okay, sometimes these both the functions may be performed by a single drug also. So these are the two main things that are done by the anti-anginal drugs. Now moving on to the classification of the drug, we have under anti-anginal drugs, we have different types of drugs are there. So first we have nitrates. Okay, these are the choice of drug that are used in the angina. So in the usually in the severe attack of the angina or for the post prophylactic situations of angina, we can use these types of drugs. Okay, so under nitrates we have short acting nitrates as well as long acting nitrates. So under short acting nitrate we have nitroglycerin. This is also known as glyceryl trinitrate. Okay, another we have isosorbide mononitrate. Okay, under long acting again we have isosorbide dinitrate and erythritol tetranitrate. These are the major drugs under nitrates that are used as anti-anginal drugs. So another class of drug we have, that is calcium channel blockers. So calcium channel blockers are mainly subclassified into 3 categories. The first one is 1,4-dihydropyridines, which consists of the drugs which ends with the spelling, that is the PINE. Okay, that is the nifedipine, amlodipine, clinidipine, etc. Similarly, we have another subclass of the drug under calcium channel blockers, that is phenylalkyl amine, that is verapamil. Similarly, another class subclass is there, that is benzothiazepine, that is diltiazem. So these are the calcium channel blockers which are used as anti-anginal drugs. Another one more class of the drug we have for anti-anginal agents, they are beta blockers. So beta blockers, it constitutes of the atenolol, metoprolol, propranolol, etc. Okay, so one more class is there, that is called potassium channel opener, which constitutes of a single drug, that is called nicorandil. Okay, some other drugs are also there which has been used as anti-anginal drugs like trimetazidine and ivabradine. So these are the some of the examples of the drugs that are used as anti-anginal agents, whereas these nitrates are of prime importance. Okay, these nitrates are of prime importance, and we will be discussing about the each and every aspects of the nitrates. Now coming to the nitrates, these nitrates causes venodilation. Okay, venodilation more compared to that of arteriolar dilation. Why it causes venodilation more compared to that of arteriolar dilation is that the enzyme which is responsible for conversion of organic nitrates to nitric oxide, okay, is more in the it is more in the veins, okay, compared to that of arteries. So what happens is the action of the nitrates becomes more prominent in veins compared to that of the arteries. Okay, so now moving on to the mechanism of action of the drug, that is the nitrates. Okay, moving on to the mechanism of action, we have either it may be exogenous nitrate or it may be endogenous nitrate. Okay, either it is exogenous or endogenous. So exogenous in the sense that is the drug which we are administering, and endogenous in the sense that endothelial cells of the blood vessel secretes the nitric oxide or organic nitrates. This both gets converted to nitric oxide. Okay, so nitric oxide, that is in the presence of their typical enzymes are there. Okay, now this nitric oxide, what it will do is it will convert soluble guanyl cyclase to the activated form of soluble guanyl cyclase. Okay, this SGC is nothing but soluble guanylyl cyclase, and as it will activate soluble guanyl cyclase, this will convert cyclic AMP to cyclic GMP. Okay, now this increased amount of the cyclic GMP, what it will do is it will activate a specific protein called protein kinase A. Okay, this is protein kinase A. Now this protein kinase A has two major functions to perform. Okay, the main function is that it will inhibit influx of calcium into cytosol, and as a result of which there is no calcium calmodulin complex formation. Okay, so as a result of which there is no calcium calmodulin complex formation, and this is the one mechanism. Another mechanism is that it will cause dephosphorylation of MLC phosphate, that is myosin light chain phosphate, as a result of which there is no interaction of MLC phosphate, that is myosin light chain phosphate, with actin. Okay, so as this nitric oxide or organic nitrates may lead to these following actions, these two actions may lead to the common function that is called venodilation. So as we all know that if there is venodilation, what will happen? There is decreased venous return, and if there is decreased venous return, what will happen is there is decreased cardiac workload. Okay, and if there is decreased cardiac workload, means if the heart is working less, then it will require energy less, means energy requirement will be less, that is oxygen requirement will be less. So there is decreased oxygen demand. Okay, so as there is decreased oxygen demand, it will treat the angina. Okay, so this is all about the mechanism of action of the nitrates. So in later classes we will be discussing about the adverse effects and all other informations regarding the nitrates and other anti-anginal drugs. Till then, thank you very much.